Hello everyone, I hope you are doing well and you have watched our videos on the 12-week antibiotic course for medical students. This video is of 10th week where we are going to discuss about case studies and clinical scenarios in antibiotic use. In the last videos, we have discussed from the history and introduction and covering the topics like mechanism of action, pharmacokinetic, pharmacodynamic, spectrum of antibiotics, adverse drug reactions, antibiotics in specific populations, adverse drug reactions, etc. will be discussed in details. If you have not watched those videos, please go on Medical Guruji and watch those videos. And in this video, as I said, we are going to discuss about case studies and clinical scenarios in antibiotic use. So let's start our today's videos of the 12-week antibiotic course. Here we are going to explore real life case studies involving antibiotic use, problem solving and decision making exercises and group discussions. We will examine various clinical scenarios to develop practical skill in antibiotic selection, dosing and management across different patient populations. So let's start. Real life case studies. First one is pediatric acute otitis media. For example, a 3-year-old girl with ear pain, fever, irritability. We are going to discuss these cases in detail in the upcoming slides. UTI, urinary tract infection, a 28-year-old pregnant woman with dysuria and frequency. Community acquired pneumonia, a 70-year-old man with cough, fever and shortness of breath. Prophylactic antibiotics. 45-year-old man with acute myeloid lymphoma undergoing chemotherapy. So what's the problem solving approach for these cases? Accurate diagnosis. Utilize clinical examination and appropriate diagnostic test. After that, there is antibiotic selection. Choosing appropriate antibiotic based on likely pathogen and patient factors. Dose determination, which is very important. Calculate correct dose and duration of treatment. And last one is follow-up planning. Schedule appropriate monitoring and follow-up evaluations. This is the problem-solving approach which include accurate diagnosis, antibiotic selection, dose determination and follow-up planning. So first case study is pediatric acute otitis media. Scenario of the case is a 3-year-old girl present with ear pain, fever, irritability. She has a history of recurrent acute otitis media. How to diagnose this? So it is a clinical examination based diagnosis including otoscopy. What's the treatment approach? So first line treatment with appropriate antibiotics and follow-up care. And the treatment approach is antibiotic choice. Amoxicillin is the first line treatment if the child is allergic to penicillin. Cefdinir or azithromycin can be considered. Dose and duration. Standard dose of amoxicillin is 80 to 90 mg per kg per day for 7 to 10 days. And follow-up, the child should be re-evaluated if symptoms persist or worsen after 48 to 72 hours. So firstly, we are going with antibiotic choice, then dose and duration of that antibiotic and follow-up. Case study 2, community acquired pneumonia. Patient profile. A 70-year-old man present with cough, fever, shortness of breath and history of COPD and hypertension. So how we diagnose this? What the diagnostic approach? Community acquired pneumonia is diagnosed based on clinical examination, chest x-ray and sputum culture. Elderly patients with comorbidity require careful assessment and targeted treatment. Treatment strategy for community acquired pneumonia. Antibiotic choice. Due to patient age, comorbidities, a respiratory fluoroquinolone, levofloxacin or a combination of beta-lactam, amoxicillin, clavulanate and a macrolide, that is azithromycin is recommended. Dose and duration. Levofloxacin 750 mg once daily for 5 to 7 days. Comorbidity management. Continue appropriate management of COPD and hypertension during treatment. Monitoring. Monitor for potential adverse effect including tendonitis and QT prolongation. So it should be considered and taken care during treatment strategy. Case study 3, which is of urinary tract infection in a pregnant woman. Scenario of the case is a 28-year-old pregnant woman at 24 weeks of gestation present with dysuria, frequency, urgency. Urine analysis confirm UTI. Diagnosis: UTI is confirmed by urine culture and sensitivity testing. Antibiotic choice: nitrofurantoin or cefalexin is considered safe during pregnancy. Treatment plan: nitrofurantoin 100 mg twice daily for 7 days. UTI management in pregnancy includes confirmed diagnosis, which is done by urine culture and sensitivity testing. Select safe antibiotics, nitrofurantoin, avoiding use at term, or cefalexin. Complete treatment course. It is very necessary to complete the course to avoid resistance. Full 7-day course of antibiotics. Follow-up testing, repeat urine analysis and culture after treatment. So these are the steps to be followed in UTI management in pregnancy. Case study 4, prophylactic antibiotics. Patient profile says a 45-year-old man with acute myeloid leukemia undergoing chemotherapy is at high risk for infections. Prophylaxis goal: prevent bacterial and fungal infections during period of immunosuppression. Medicine strategy: combination of antibacterial and antifungal prophylaxis during vulnerable periods. Prophylactic antibiotic management. So antibacterial medicine is ciprofloxacin, dose is 500 mg twice daily and duration is during neutropenia. Antifungal fluconazole, dose is 400 mg once daily and duration is during neutropenia. Monitoring: regular blood count and monitoring for potential side effects such as tendonitis, which may be due to ciprofloxacin, and hepatotoxicity, which is due to fluconazole. All this should be taken care. So next, problem solving exercise for diabetic foot ulcer. Clinical scenario: a 60-year-old woman with diabetes present with a diabetic foot ulcer. The wound is purulent and there is surrounding erythema and warmth. Key considerations are: diabetic foot infection are often polymicrobial and require comprehensive management including glycemic control, wound care and appropriate antibiotic therapy. Discussion questions. So question is, what diagnostic tests are needed, what are likely pathogens, and what empirical antibiotics should be started. So I request mention this in the comment section to answer this question. So here is the answer. Diabetic foot ulcer. First one, diagnostic test. What initial diagnostic test should be performed? Answer these in comment section. Second, pathogens. What are the potential pathogens in this case? Third one is empirical therapy. What empirical antibiotic therapy would you initiate? And last one is treatment adjustment. How would you adjust the antibiotic regimen based on culture and sensitivity results? And last question is, what are additional management strategies are important in this patient? Answer these questions in the comment section and continue the video with the next cases. Comprehensive management of diabetic foot ulcer. Diagnosis is made by deep tissue culture, blood test, imaging. Antibiotic therapy, broad spectrum initially and then targeted. Wound care, debridement, dressing and offloading. And last one is glycemic control, which is very important. So optimize diabetes management. These are the steps which should be taken care in the management of diabetic foot ulcer, including diagnosis, antibiotic therapy, wound care, and last one is glycemic control. Group discussion and presentations. Collaborative learning. It is very important engage in group discussions and presentations to explore various clinical scenarios and case studies. Knowledge sharing is also important. Share experiences and insight to enhance understanding of complex antibiotic management scenarios. Critical thinking. Develop problem solving skills through interactive case based discussions. All these are the important steps to enhance the knowledge. Discussion topic again is multi-drug resistant infections. So challenge. Multi-drug resistance organism present significant treatment challenge in clinical practice. Increasing rates of resistance to common antibiotic limit therapeutic options. Discussion focus. Challenges in treating multi-drug resistance infections. Cause. Discuss strategy for managing infections caused by the resistance organisms. Novel antibiotic combinations, alternative treatment approaches, infection control measures and prevention strategies. All this should be taken care in the discussion focus so that we can overcome the multi-drug resistant infections. Discussion topic of antibiotic stewardship. First one is appropriate selection, right drug for the right infection, optimal duration, shortest effective course so that resistance cannot be there, monitoring, track outcomes and resistance, and last one is education, provide to the patient awareness and even to the family members. So next one is about management of sepsis. In the first hour 0 to 1, recognize sepsis, obtain cultures, start broad spectrum antibiotics so that complications can be managed. In the first to 3 hour, fluid resuscitation to be done, vasopressors if needed and source control. In the hour after 6 hours to 24 hours, reassess antibiotic therapy based on culture results. And after 24 to 72 hours, de-escalate antibiotics if possible and continue supportive care. So management of sepsis is as early as possible to prevent complications. Interactive case presentations, it includes student-led presentations. Student present complex antibiotic management cases to peers and receive feedback from instructors. It should enhance the knowledge about the use of antibiotics. Team-based problem solving. Small groups work together to develop comprehensive management plan for challenging infectious disease scenarios like multi-drug resistance. Simulation exercises. Practical clinical decision making in simulated emergency scenarios requiring rapid antibiotic selection and dosing. So here the summary, clinical decision making in antibiotic therapy. What are the factors which affect? So antibiotic therapy require careful consideration of multiple factors which include patient characteristics, likely pathogens, antibiotic properties, local resistance patterns and stewardship principles. The case studies and discussion in the presentation highlight the importance of a systematic approach to clinical decision making in infectious disease management. So at the end we discussed lot of cases and I hope your knowledge is improved after this. If you have any doubt, you can ask in comment section and like the video, share and subscribe our channel. Keep watching. Thank you.